Okay, thank you. Welcome, everyone. This is a webinar on statistical thinking in public health. And I'll go ahead and share my screen and also share a little bit more about myself very soon. So I work here at the University of Montana as a statistician. I taught introductory statistics here at the university for 10 years and then moved into public health about 3 years ago. So I've been primarily working in research, but have a lot of also background just teaching and thinking a lot about statistical literacy and very passionate about helping the community become statistically literate and just being able to communicate statistical ideas. So I'm going to kick it off by just trying to learn a little bit more about you, just so that I have a sense of who you all are and what everyone's goals are basically, and or just where they're coming from. So if you wouldn't mind just putting in the chat just your name, and anything that you don't want to share is completely acceptable, but just a couple of things: your name, what county you're from, maybe your organization, and if you use statistical software, what statistical software you're using, whether you're working from home or in an office, favorite sign of spring, and anything else you want to add. Just a couple little tidbits just to kick us off. If you want to put those in the chat, I would be grateful. This is a little bit more about me. Again, Cindy Leary. I live in Missoula County, and thank you all for sharing all of that information. So I work in the School of Public and Community Health Sciences as a statistician, and I mostly focus on R, but I'm familiar with a few other platforms. And I put on there, I secretly love StatCrunch, which is kind of this online platform, which is really user-friendly for people just getting their hands dirty with data analysis. And it's very inexpensive. And I have an office here on campus, which I'm in, but I've been working a lot from home. And I'm just really excited to be out on those trails, enjoying the wildflower, well, the coming wildflowers. And that's all I have to share with you for right now. Let's see here. And Emily, is my screen all good to go? Okay, thank you. Okay, so why do we need statistical literacy skills, and why is this an important thing to be trying to work on as we develop ourselves as professionals and community members? And here's just, there are quite a few different avenues that we can go with statistical literacy, and that can help us in everyday life, but also professionally. They can allow us to be able to collect, synthesize, and analyze data that can help us better understand public health problems and solutions. This is one of the ones that I think is the most important, is just being able to really critically consume both just common news articles and peer-reviewed public health literature for maintaining best public health practices, introducing new practices, but then also being able to talk intelligently with colleagues and the community about, about complex public health ideas. And so these are, just some of the reasons why I'm so passionate about statistical literacy, and really being able to understand the basic building blocks of what we call the field of statistics. So I cited this paper on this fourth bullet here, this titled "Statistical Methods Used in the Public Health Literature and Implications for Training of Public Health Professionals." So on the next page, this is just a table that I took directly from their paper. But what they did is they randomly sampled 216 public health articles from 7 top-tier journals. And they looked at what types of methods, inference procedures were being used in these top-tier journals. And so you can kind of look a little bit here about the types of study designs, which we're going to talk about today, the types of statistics being used, what type of inference procedures being used. And so even if you don't know what inference procedures refer to, this is just basically a breakdown to show you that, if you're looking at these different percentages, so 82% were observational studies. And then if we look at summary statistics, 92% of these papers presented some descriptive statistics, 95% are presenting tables, 62% are presenting charts, and these different, also in the way that they're presenting these data, if we're looking at prevalence, relative risk, odds ratios, 41% are really big in public health, hazard ratios, 15%. Then when we get down to statistical inference, I'm sure that you have heard the term p-value. That shows up 73% of the time in these articles, confidence intervals, 76%. So, depending on your level of comfort with statistical inference and charts and tables, maybe you're going to be producing these types of figures and results, or maybe you just want to be able to critically consume them. And both are possible, but we just need to educate ourselves so that we can better understand where these figures and numbers are coming from, so that we can make better decisions and learn from these types of studies. So that's just a little bit of a motivator there. This is one of my favorite videos. It's just a 2-minute video to kind of motivate. I like to show this at the beginning of introductory statistics courses. So hopefully you'll appreciate this. It's just a 2-minute TED Talk by Professor Arthur Benjamin. So we'll play this here for you.
Well, if President Obama invited me to be the next czar of mathematics, then I would have a suggestion for him that I think would vastly improve the mathematics education in this country. And it would be easy to implement and inexpensive. The mathematics curriculum that we have is based on a foundation of arithmetic and algebra, and everything we learn after that is building up towards one subject. And at the top of that pyramid, it's calculus. And I'm here to say that I think that that is the wrong summit of the pyramid. That the correct summit that all of our students, every high school graduate should know, should be statistics, probability and statistics. I mean, don't get me wrong, calculus is an important subject. It's one of the great products of the human mind. The laws of nature are written in the language of calculus. And every student who studies math, science, engineering, economics, they should definitely learn calculus by the end of their freshman year of college. But I'm here to say, as a professor of mathematics, that very few people actually use calculus in a conscious, meaningful way in their day-to-day lives. On the other hand, statistics, that's a subject that you could and should use on a daily basis, right? It's risk, it's reward, it's randomness, it's understanding data. I think if our students, if our high school students, if all of the American citizens knew about probability and statistics, we wouldn't be in the economic mess that we're in today. Not only that, if it's taught properly, it can be a lot of fun. I mean, probability and statistics, it's the mathematics of games and gambling. It's analyzing trends. It's predicting the future. Look, the world has changed from analog to digital. And it's time for our mathematics curriculum to change from analog to digital, from the more classical continuous mathematics to the more modern discrete mathematics, the mathematics of uncertainty, of randomness, of data, in that being probability and statistics. In summary, instead of our students learning about the techniques of calculus, I think it would be far more significant if all of them knew what 2 standard deviations from the mean means, and I mean it. Thank you very much.
Okay, so I just wanted to share that. I just think that's a really nice introduction, very motivating, setting the stage for where we're going for the next few hours. And I do like to just take a little bit of time and look back and understand how we became to be where we are right now, and the pioneers who developed statistics in the public health framework, and how much that we have gone through in order to be able where we are today, and and all the technology that we have and all the knowledge that we have about study design, analysis, and how we've built up to that today. And it's taken a lot of pioneers to come up with that. So the first one I want to highlight is James Lind. In 1716 to 1794, was a Scottish doctor, and he was really focused on preventative medicine and nutrition. And he conducted the first ever documented clinical trial. It was a very small scale, but he was looking for a cure for scurvy. And so when he was a surgeon on the ship, he selected 12 men from the ship who were suffering from scurvy. And they had similar symptoms. So there are some things that we want to start thinking about here. Okay, so they're all hopefully fairly similar in the things that they're experiencing. And then he divided them up into 6 groups of 2, so pretty small experimental groups here, but then assigned each of them to a different diet. Okay, and so this is what's known as a controlled experiment on a very small scale. But these are the 6 diets that he was interested in studying. So he gave each of them, so for the first 2, he gave them a quart of cider per day. For the next 2, 25 drops of this elixir. The third group, 2 spoonfuls of vinegar 3 times a day. Then the fourth group, a half pint of seawater every day. These are sounding very good on an empty stomach at 8 a.m. A nutmeg size electuary 3 times a day, and then 2 oranges and 1 lemon every day for 6 days. So these are the 6 treatments that he gave. And of course, we now know that these 2 oranges and 1 lemon, this vitamin C, is a common way to cure scurvy. And so he ended up finding that this group did better than the other groups, the group that had the vitamin C. Then we have Florence Nightingale, and she has, a lot of her biographies and information are really fascinating to read. From 1820 to 1910, she was really this, just a pioneer nurse and, statistician, although we didn't really know what statisticians were then. But she was most well known for her work during the Crimean War, beginning in 1854. And she really developed these data visualization techniques to help better understand some conditions that different people were going through in the war, and realizing that these conditions, that the cleanliness conditions that they were going through, were a large contributor to some of the mortality that they were seeing. And so she was able to help reduce that with a lot of her work. This gentleman, Ignace Philip Semmelweis, 1818 to 1865, there's a wonderful This American Life podcast on this story, and this came out right when COVID hit a year ago, and when we were starting to just be so vigilant about hand washing. But this was a Hungarian physician and scientist who pioneered the use of antiseptics in medical practice. So he was a brand new doctor and wasn't part of the leadership team at this hospital, but he noticed that new mothers were experiencing 3 times the rate of deaths when being treated by a doctor in the delivery room than when having a midwife deliver their baby. And so he started to notice this large discrepancy, which now we would call statistically significantly different. And he also noticed that these doctors who were in the delivery room were into doing a lot of autopsies and dissections in the morning, and then delivering babies, in the maternity ward with their hand washing was not even on their radar, no sanitizing of hands in between duties. And so Semmelweis came up with this theory that they were actually infecting these women once with their dirty hands. And despite his striking findings, the doctors rejected his conclusions. And it wasn't, and his work was not recognized until many years later, and he spent his life being ridiculed for these issues that he was bringing up. So it's a very sad story, but he was a large pioneer in public health in that way. So I just think it's a really interesting, really interesting and powerful story. Then we have Jonas Salk, was an American physician and researcher who developed one of the first polio vaccines. And he conducted one of the largest known trials in the United States, which, we are now well versed in these vaccine trials right now. But this included 1.8 million children, this vaccine trial. And we'll talk a little bit more about experimental design, and I'll come back to this. But there was quite a bit of debate about whether, when they're trying to test these vaccines, how to design this experiment so that they could really understand whether the vaccine was working or not. And so they were trying, so there was debate on how to establish the control group versus the group that would be vaccinated. Would they randomly assign, would there be people to vaccine or not? Would there be a placebo vaccine? And so there were actually 2 different types of designs, which hopefully we'll have time to look at. But now we have this happening again. So I just found an article that came out yesterday in the Washington Post that was referring to this. Maybe you all have already heard about this, but these Fred Hutch researchers, which is a large research facility, they just embarked on a study of 12,000 college students to learn if the common mRNA vaccines, such as Pfizer, Moderna, that are being used in the US are effectively preventing asymptomatic transmission. So they are going to, this just sounds like such a huge undertaking to have 12,000 students all over the US. And they are going to, once they are enrolled, half of them will get the vaccine now, and they've already started to get the vaccine, and half will get the vaccine, I think 3 or 4 months from now. And they will swab their nose every single day to see if there are signs of the virus. And then from that, try and understand if that virus is being transmitted. So then they're also going to be monitoring their close contacts, and then monitoring how much of the virus is present in their nasal passage. It just sounds like a that a lot of work went into developing the design, and now they're going to be just so much work involved in trying to study whether, now that once someone gets vaccinated, are they also are they also preventing the transmission once they're actually vaccinated. So yet another experiment that's going on here. So so that's I just wanted to kind of give you a little bit of a brief history, and then give you the outline that Emily sent to all of us as well, but just kind of talk through this with you. So this never happens to me, but I'm actually a little bit ahead of schedule. So this part one, which is great because I have a lot in here too. So part one was just the history of statistics and public health, so that we can get a little bit of an appreciation of, you know, how much has happened preceding us. And there's so many other examples as well. But then in part two, we're just going to talk about, you know, just basic data, defining what variables are, understanding a little bit more about documentation, organization, data cleaning. Then we'll take a little bit of a break. And then we'll talk about graphical displays, which in my opinion are some of the most important things that we need to be able to create and understand how to read. And then we'll watch a fun little 4-minute video. And then we'll talk about how to actually collect data. Once we know how to create these graphs, we'll talk about collecting data. And then the last part, we'll talk about some statistical inference.